Next, we have the presenting author is Dr. Naina, and it's about role of spectacles in management of migraine, truth or myth. Please. Only 2 more left. We finish in time. We have till 2:45.
Good afternoon, everyone. So my study is on role of spectacles in management of migraine, truth or myth. Introduction. Migraine is one of the most widespread debilitating condition with a global incidence of 14%. A significant number of migraine patients turns to ophthalmologists for consultation. Even though small refractive errors do not typically result in substantial headaches, serious refractive errors can result in headaches. So even in migraine, even these small refractive errors can act as these small refractive errors can act as a trigger. Coming to need of the study, migraine headaches negatively impacts the quality of life and overall productivity of a person. So preventing various triggers is the most effective management approach for migraine. So we aim to explore the role of spectacles in migraine management, including potential psychological impacts. Our objective is to determine the effect of spectacle correction on frequency and intensity of headaches in migraine patients. We included 250 clinically diagnosed migraine patients attending ophthalmic OPD at HIMSS Hassan. It was a non-randomized interventional study. We excluded all other types of headache, including cluster headache, tension headache, and secondary headaches. All high uncorrected refractive error, more than 1 diopter, spherical or cylindrical error were excluded, and patients already using spectacles were excluded. Patients presenting in acute phase preventing ocular examination and patient having pre-existing ocular diseases were excluded. So methodology, apart from detailed clinical history, we have taken detailed history of headache, and we have done grading of migraine at the beginning of examination, and we have given appropriate spectacle correction, and follow-up was done after 3 months, and grading of migraine was done. So the majority of our patients fell in age group of 21 to 30 with a 58% female population. And coming to grade of migraine, 48% was grade 1, 44% of patients had grade 2 migraine, and 8% had grade 3 migraine. Refractive errors, majority of the patient, 32% had cylindrical error, and 38% we found no refractive errors. Coming to follow-up, 69% of after 3 months, 69% of patients showed improvement in the migraine grade. 27% continued with the same migraine grade, and 4% had worsening of the migraine. So among patients who were prescribed with plano glasses, 72% patients showed improvement, and 25% continued with the same grade, and 2% showed worsening. So similar studies were there where they have correlated between migraine headaches and refractive errors. And in our study, out of 250 clinically diagnosed migraine patients without any significant refractive errors, when treated with spectacles, nearly 70% of the patient improved symptomatically. Even those without any refractive errors using plano glasses, 72% showed improvement. So to conclude, even mild and non-significant refractive errors seems to be linked to migraine. Tackling the link between mild refractive errors and migraine holds the key to dial down both the frequency and intensity of these headaches. So clear lenses leads to clear mind. Plano glasses stepping into the spotlight as a psychological touch in migraine. Thank you.
Thank you. I think I like that point about the using plano glasses as a psychological measure to help migraine patients get better.
Yes.
And it seems to have worked in your study.
Yes, ma'am.
There was no mention of the lenses, whether there was any tint in the lens, whether there were any ARC coating, whether there is any photochromatic. Have you used any of those on the lens, or just clear plano lens?
Plain glasses.
No tint, no thinning. You have checked that there is no, when you actually advised, did you check whether they had the ARC or their tint or their photochromatic lenses used?
Not from photochromatic glasses.
Because that could be one of the cause.
Yeah, because it can prevent the one of the trigger is light. So
light effect. See, because even if we do not prescribe photochromatic glasses, opticians tend to tell the patient कि ये अच्छा रहेगा आपके लिए, ये coating करा लीजिए, ये tint करा लीजिए, it cuts down the blue filter. I'm telling you, blue filter is such a big thing nowadays that even my children refuse to believe me when I tell them it is of no use. They tell me there are studies. Ma, you don't know. So I tell them, okay, I don't know. You go ahead. Because, see, these days everybody reads up on Google. They use the internet half the time, more than half the times before they come to the doctor. So you should have specified that, whether, as Sir said, that whether it was without any tint and
Yes.
no photochromatic and
Right.
all that. But it's a good attempt to understand migraine, which is really a problem for the patient to deal with. Thank you.
Thank you.